Hi everyone, I'm Amanda Ralph, a nurse practitioner and the owner and founder of White Coat Aesthetics here in Las Vegas, Nevada. Okay, today I thought it'd be fun to talk about how to be the perfect injectable patient. So I've created a list of 4 things that will make you a perfect injectable patient at my practice. This is not necessarily for every single practice, but these are my favorite clients. Number 1, you want to be secure within yourself. I know that what we are doing is discussing the areas that we want to improve or the areas that we have concern, but it's important to me that I have clients who are not putting all of their value and all of their weight on how they look, but rather are just looking for small improvements, things to make them feel better about aging. I really do find it hard to treat patients who are just extremely insecure and not very happy with themselves in general, because truly injectables are not a total fix if that's how you're feeling. My one kind of counter when I'm trying to figure out if someone is a good client in this regard is I do my full face consult with them using their pictures. I ask them to first point out a few things that they like about themselves. If I have a client who won't even look at the picture, who can't think of one nice thing to say about themselves, I do feel like that is a bit of a red flag, because ultimately if you're not somewhat happy with yourself, you are really not going to find any sort of improvement with injectables. Okay, the second way to be a perfect injectable patient is to come in for a full facial balancing consult. I do a full facial balancing consult at my practice. We take your pictures, I bring you back in the room, we take a look at everything, and then we make a plan. My favorite clients are those who kind of have an understanding of what they're interested in, but are open to other opinions and also not fully set in stone. It is so hard to be an injectable client right now. I completely understand. There's so much information out there and not all of it is good, and it's really hard to sift through some of that. But the problem that I'm finding is that people will do the research online, overlook into everything, that they scare themselves out of anything, and then also they come in maybe a little too hardwired on the plan. If you trust your injector and you've been following them for a long time and you know that you're going to someone good, then you should trust their expertise and what they recommend for you. For me personally, I do tend to, of course, treat the area that the patient's interested in, but if there's something underlying causing that, I want to treat that as well, rather than just shoving a bunch of filler in an area just to make you happy for the short term. I'm thinking about all of the years that you're going to have this product with you. Number 3, way to be the best injectable client is to come in with a proper kind of pre-care expectation with your skin. I always want to just stress to people that injectables, they really have become a little bit too casual in my opinion. For a few years, it's kind of been almost in line with like getting your lashes and your hair done. But at the end of the day, these are still medical procedures. There are a lot of risks associated with them if they are done incorrectly, if bacteria is introduced to an area. So the best way to plan for a very low risk procedure is to do the pre-care instructions. Avoiding alcohol, avoiding NSAIDs, any sort of blood thinner is going to make you bruise. I really love patients to come without any makeup on. I will, of course, clean your makeup off in the room if you have it, but if you can come with a fully clean face, that is just one extra step to preventing any sort of long-term issue, short-term infection. There are so many risks associated with these things when we don't take proper care. Really, if you're going to go the extra step, have your hair pulled back, nothing on your face, outside of just your daily sunscreen that I would love for you to wear. But following the pre-care instructions is so important if you are wanting a good healing and aesthetic appearance. And the final way to become the best injectable patient is to come in with proper aftercare expectations. So just as pre-care is important, aftercare is just as important. When you leave, I ask my clients to wear no makeup for at least 24 hours post injectables. I really prefer people to lay low, no heavy exercise for about 24 hours, no massaging of the area. I always just say hands off as much as you can. I am okay with icing because it can help with discomfort and swelling, but even that, if you're feeling fine, there's really no reason to add anything to these areas. It is so important in the short-term healing process, but also for long-term complication prevention, is to avoid introducing any sort of bacteria or pathogens to the area for the first 24 hours post-treatment. For me, the best patient is the one that is just ready to lay low, doesn't have any sort of party or date planned, is not planning on wearing makeup right after. just because I want your skin to have time to heal. It can really make the difference for your skin. I always say the best aesthetic outcomes are given to those who are the best aesthetic patients. So if you come in with a good outlook on how it's supposed to be, with the proper pre-care, proper post-care, you found the good injector that you have established a relationship with, you're going to have great outcomes. So those are my 4 ways to become the best, perfect, most perfect injectable client. If you have any questions, please leave them below. If there's anything else I missed, please leave them below. I love to hear other feedback, and I will see you in the next video.